It's hard to come into work some days knowing that you're short and knowing that you're going to see people die.
I've seen more people die in the last 7 days than I've talked to my own family members.
Prior to this pandemic, like me personally, I'll get attached to patients or I'll get emotional when somebody's not doing well, but it's different now than it used to be. You know, you go into nursing or you go into being a physician to help people, and it's draining when you can't.
Things were steady, and then all of a sudden, boom, we're seeing community members coming in. They can't breathe anymore, so they come into the hospital, and it just seems to be nonstop.
We're a lot better at treating at this time, but people are very, very sick.
I have a coworker who has worked the last 14 days. Multiple of us have worked, you know, going on, like I'm going on day 7. So we pick up and then hopefully we get a small break.
We might have some open beds, but with the staff that we have available, sometimes we're close to our safe capacity for the number of staff that we have.
Fall into winter is our normal respiratory season. It gets icy, people falling, everyone's trying to get their surgeries before the end of the year. So just the added numbers of having the COVID patients just has been really hard to handle.
Well, in the short term, this surge that we've seen this fall, we have prepared and we have volunteered and we have come in and worked extra shifts to get through this. So the thing is what's going to happen next?
We really are depending on people being responsible over Thanksgiving so that we don't have the surge like we did this last month, because we can't sustain that.
We're capable of taking care of people now, but if the spike continues to go up, at some point our capability will hit a cap, and we're not going to be able to accommodate everybody that needs care.
U.S. now averaging close to 160,000 new COVID cases a day. Health officials say that 40 million vaccine doses will be ready to go by the end of this month. But who will get vaccinated first? A CDC panel is meeting today to decide just that. Our country's 21 million healthcare workers will likely be first in line, followed by nursing home residents and staff. The head of Operation Warp Speed saying the entire U.S. population could be vaccinated against COVID-19 by June. But it is only December, and right now more than 96,000 Americans are in the hospital with the coronavirus, a number that's only expected to get worse over the holidays. NBC News correspondent Rahima Ellis is outside Elmhurst Hospital, that's in Queens, New York. Rahima, this hospital was inundated with patients back in the spring. COVID admissions are ticking up again. How is Elmhurst prepping for another rush of patients?
Allison, this hospital and hospitals statewide have been asked by the governor to make a list of retired doctors and nurses whom they can call on in the event that the cases become so overwhelming. The governor says they're already reaching this point. And the reason they're asking them to do this is because they cannot expect a cavalry of professional doctors and nurses to come in and help, as we saw from out of state and upstate last spring when the city found itself as the epicenter of this coronavirus outbreak. All across this country, we are seeing surges, as you just mentioned. So there's no help coming. They've got to find the help from within. And so this hospital and all across the state, they're now making a list of an auxiliary team, if you will, that they can call on if needed. Allison?
Rahima, New York Governor Andrew Cuomo warning the state could go back on pause if hospitals fill up. So what is New York State doing to try to prevent that from happening?
Well, we know in one county, they're already asking the hospitals to put on hold, if you will, elective surgery so they can concentrate on emergency surgeries and emergency cases. They don't want the hospitals to have to deal with all kinds of medical issues while they're now dealing with this increase in the coronavirus. And the governor is concerned that following Thanksgiving and the number of people who decided they would not pay attention to the warnings to basically celebrate in place, if you will. He's expecting, Governor Cuomo is expecting, we're going to see these numbers of coronavirus cases going up even higher. And it's not just Thanksgiving, which is past, but now we're into the real holiday season. And the expectation is that there will be more people who are feeling fatigue from these restrictions and that they might go out and continue to congregate with family and friends, and that could lead to these numbers going up even more. He's warning against it, but trying to prepare for it.
Rahima, New York City released this statement today warning, quote, the city's health commissioner is advising older adults, people with underlying health conditions who are at an increased risk of severe COVID-related illness to limit activities outside the home. What else is the health commissioner saying here?
They're taking it a step further, Allison, and they're saying not only should those who are 65 and older limit their activities outside of the home, but their loved ones should do the same, as well as their caregivers. Come and provide care for the person in need, yes, but when you leave, do not engage in a lot of extracurricular activities. If you're a loved one, limit yourself to people coming into your home or to homes that you would be going into, because it's something that's very simple. The more you increase your number of people that you are connected with, you increase the potential of contracting coronavirus. Then that means when you visit this person who's at greater risk, you put them at even greater risk because of the fact that you might be contagious. Maybe you don't know it, but you could be a spreader. So everybody is being asked, if you care for someone who's at risk, if you love someone who's at risk, they're going to limit their activities outside of the home. You do the same, too, in order to keep them safe. Allison?
Rahima, let's hope people listen. Let's hope that it works. Rahima Ellis in Elmhurst, Queens, thank you.
Hi, Allison. Yeah, it's a pretty dire situation here in the state of Rhode Island. I was here just 2 weeks ago, and 2 weeks ago they said we're reaching full capacity at the hospitals. It's not a matter of if, but when we're going to have to open up some field hospitals. And guess what? Now, 2 weeks later, I'm back here once again with 2 field hospitals opening up. One in Cranston, Rhode Island, where they have 300 plus beds. I spoke with the doctor a little bit earlier today, and she said they've checked in 7 patients at that field facility. And then here in Providence, Rhode Island, an alternative care facility that has just over 600 beds, and they have a few patients that have checked in so far today. Over the last 2 days, they've opened up 2 field hospitals in the state of Rhode Island that has a population of just 1 million people. On top of that, behind me, you see a testing facility. This is a drive-up testing facility where they conduct PCR tests. Just around behind this vehicle is a walk-up testing facility. And then behind my cameraman, Jeff, he's not going to swing around and show you, but there's a walk-up testing facility as well for folks to come in and get rapid testing. The numbers are going up every single day in this state, despite the guidelines that have been put in place to try and mitigate the spread. I spoke to the vice president of this field facility a little bit earlier today. Here's what she had to say. Are you seeing a different type of patient now than you were in the spring?
Yeah, so in the spring, we saw a much higher proportion of patients requiring ICU level of care. But I think with the therapies that have been developed as we've learned more about the illness and the way we identify and treat these patients early on, we're seeing less need for ICU care. The other thing that we're seeing that's different is it's hitting a younger demographic. We're seeing people in their 20s and 30s, more so than we did in the spring. Some will attribute it to the lack of social distancing, but the population is different.
And Allison, today is day 1 of the pause in the state of Rhode Island that the governor instituted. What does that mean? It means just over 30% capacity in religious institutions, meaning churches, 25% capacity in indoor dining. However, schools are still up and running because they've identified the fact that schools actually, for elementary school children specifically, are not a vector for spread. And that's happening really across the nation. So up until they see the numbers increasing in schools, they're going to keep elementary schools in this state open for in-person learning. Nonetheless, this is really a wait-and-see moment in which many of the officials in the state are going to be watching the numbers throughout the days to see if they can slow the spread of this thing and gradually reopen businesses throughout the state. But until then, these field hospitals are up and running.